at the University of Maryland. Thank you for joining us today for part 2 of our community conversation for all about mental health, racism, and racial trauma within the context of COVID-19. So many of you joined us on Tuesday for part 1, and we're grateful for that. Welcome back. Today will be an engaging discussion as Tuesday was. We hope today to focus on ways for you to talk to children and help other family members cope with mental health impacts that racism and racial injustice create. Undoubtedly, most of us will agree that the past few weeks have been very trying and very stressful as we've watched a series of racial injustices, assaults, and the death of George Floyd unfold in the media. We as adults are impacted, but our children are watching and listening, and they too are impacted as well. How we talk to them in this moment is critical. Again, here to share with us today are 3 exceptional professionals. Dr. Brittany Parham, Assistant Professor at the University of Maryland School of Medicine. Dr. Parham has a decade of experience training school administrators, educators, and school police on the effects of trauma and effective health interventions for trauma-exposed youth. Dr. Dana Cunningham, Faculty Consultant at the National Center for School Mental Health at the University of Maryland School of Medicine. Dr. Cunningham is a licensed clinical psychologist with significant experience providing direct service in urban school districts, as well as training and technical assistance to state and local education and mental health agencies. And Dr. Sharon Hoover, Associate Director in the Division of Child and Adolescent Psychiatry in the School of Medicine. She's the co-director of the National Center for School Mental Health and the director of the Center for Safe, Supportive Schools. Recently, she's been providing services to school districts, children, and families during COVID-19. Just a couple of comments before I turn the program over to them. The content of today's presentation deals with issues that some may find distressing. Of course, it's not our intent to cause any additional stress for anyone, but this content is of vital importance to understanding mental well-being and safeguarding against the issues we are confronting today, both COVID-19 and racial trauma. If at any time you feel overwhelmed, please feel free to take a break for whatever period you may like and rejoin us when you choose. I'll also say that momentarily we will post for you a link in the chat box that will provide resources in case anyone thinks they're in an emergency situation and want help right away. Reflections. There'll be several opportunities during this presentation, as we had on Tuesday, for our participants to share and record your thoughts and your reflections. These items will only be shared with the presenters, and you can post them in the question and answer box. The chat feature is actually turned off, so any comments that you might want to make, do so by using the Q&A box. You can also pose questions at any time. We'll try to take as many questions as we can toward the latter part of this webinar. And finally, let me just say that this presentation is designed to provide general information. It's not a substitute for individual medical or mental health advice. Please contact your primary care provider for specific information, guidance, or recommendations should you choose. And also, if you're looking for information related specifically to COVID-19, please feel free to visit our website at www.ums.org/coronavirus. And with that, Dr. Hoover, would you like to get us started?
Thank you so much, Donna. I appreciate the invitation to join you, and I'm privileged to be here today with my colleagues, Dr. Patterson and Dr. Cunningham, who I've had the pleasure of working with for a number of years. This gives you a bit of an outline of what we're going to be addressing today. And as Donna said, we hope for today to be a conversation. And so we will invite you throughout our discussion today to enter your thoughts, experiences, and questions into the Q&A box. We'll have some specific questions for you, but also please feel encouraged to enter in your own ideas and questions, and we will do our best to try to address some of those throughout, and particularly at the end of our session today. So today we're going to start just briefly touching on the mental health impact of COVID-19 on children and families before we move into the bulk of our discussion, which will be on the impact of racism on children, and also talking with children about race and racism. And throughout the conversation, and particularly at the end, we'll talk specifically about coping strategies and resources about racism for children and families. As Donna mentioned, what we'll be talking about today is filled with some sensitive content, and it may cause feelings of heightened distress. We encourage you to take in what you feel is right for you right now and to practice self-care throughout our talk today and beyond. And as I mentioned, we'll review some coping strategies toward the end. So we want to start with a brief discussion on the mental health impact of COVID-19 on children and families. And we do this in part because this is part of a series on COVID-19, but also in the context of our discussion on racism and systemic racism in particular, we know that communities of color, and particularly Black communities, have been disproportionately burdened by the impact of COVID-19. And so when we talk about the current context of stress and mental health and its intersection with racism, we want to keep in mind that we also have this extra layer of the stress and economic and health burden associated with COVID-19. And a number of people really are struggling right now and looking for coping strategies and resources specific to COVID-19. So we just want to share a bit about that. We're first going to start with a question for you. So this is your first opportunity to try to respond in that Q&A box. So we'd like to hear from you what you see as the biggest mental health concerns related to COVID that you're seeing in children, whether it be your own children or children in your community. You can go ahead and enter that into the Q&A box, and I see some folks already entering in. And after we go through a bit of content, we'll revisit some of the responses and look for some themes to see what people are saying they see as the biggest mental health concerns for children. So we know that the impact on mental health for young people and adults alike is significant right now. We know particularly for individuals who were already struggling with mental health concerns, COVID-19 has potentially worsened some of the mental health concerns that they were experiencing. But we also know for many individuals, they're reporting new struggles with mental health that they may not have been experiencing pre-COVID. Some of this for children we know may be in part related to social distancing, school closures and disruptions, shelter in place and some of the isolation that our young people and families are feeling, and also just the very disruption in daily routines can be incredibly troubling for young people and families. And so there's actually some really good data to suggest that unfortunately, people are experiencing more worry and anxiety than typically, and also just more sadness and depression. And for some, this has been an incredibly traumatic experience with loss of family members, friends, community members, and also just the loss of jobs and other routines that they may have had in their life. In terms of coping, we won't go into great detail about coping specific to COVID today, but we want to remind ourselves of a few basic principles. What kids need, what children and adolescents need, really regardless of age, is to feel loved and protected, to feel understood. So creating the space for them to share their feelings and really validating their feelings, for them to know their feelings, so giving them space to talk through those, and to feel capable. So opportunities for them to feel effective in their daily functioning. One of the words that we keep in mind as we work with our own families and families in our community is the term staying safe. So on the next slide, we point out that if nothing else, if we can try to have our young people engage in these 4 areas that correspond to the letters of safe. So first, social. So encouraging kids each day to have something social, and that could be calling friends, playing games with family. Active, that can be dancing, walking, running, even going on YouTube and doing some exercises. Fun, choose an activity that your child enjoys, maybe a parent-child activity. And then finally, effortful. We talked in the previous slide about kids needing to feel capable. And even though they may not want to do those chores during the day, it is important for them to feel that they are doing something important and meaningful. And so, in some way, for them to do something effortful can be important. So I'm going to ask Britt to take a moment to review what we heard from our community and participants today about the biggest mental health concerns related to COVID that they're seeing in children.
And it would be my pleasure. Thank you so much, Dr. Hoover, for kicking us off. And thank you all for attending today. And we are just really appreciative of all of the participation so far. You guys are ready for the rest of what we have planned for you. So there are a number of themes that popped up in the chat boxes. A big one was concerns around kids feeling isolated, also communicating feelings of sadness and depression. Additionally, there were a lot of folks commenting on the disrupted or lack of routines and schedules for students and young kids. Additionally, anxiety and fear specifically related to increased exposure to difficult news in the media. And so we thank you so much for offering your ideas during this segment of the presentation. We ask you to continue to give us your feedback throughout. All right, so we're now going to move into talking a little bit more about the impact of racism on children specifically. And as you've already seen, we like to give you all an opportunity to talk to us a little bit about your thoughts. And so please feel free to begin responding. What have been some of the emotions children are expressing related to recent highly publicized events involving violence against African Americans in the media and the increased focus on social justice? As you all begin to respond and engage with us, we're going to talk and provide a little bit more information. So we want to dig into the impact of racism, discrimination, and prejudice on children. What we actually have here is a video that we're not going to play right now, but I would like to provide a little bit of information about this video. It features a young girl, and she's really cute, as you can see. She's 4 years old at the time, and her name is London James. And this is a video of her mother recording her on the way home from her daycare provider. In this video, which you will see, is that young London is crying and saying to her mother, it makes me sad. And her mom is asking her, what makes her sad? And she responds that they don't want to be my friend. To which her mom asks, well, why? And she says, because they don't like Black people. And so as we listen to that type of content coming from a 4-year-old, what that demonstrates for us is that the impact of racism, discrimination, and prejudice is clear, and it starts at a very young age. This young cutie is only 4 years old at the time. And so on the left there, what you see are some of the mental health challenges that we know are associated with experiences of racism, prejudice, and discrimination for young children, including anxiety, feelings of low self-esteem, as well as guilt and shame about how they appear to others. There are also increased likelihood of depression amongst youth of color, and potentially symptoms of post-traumatic stress disorder. Important to note here is this notion of racial trauma. Many folks may be familiar with the terminology trauma, which is used to describe an event or a series of events that is perceived by an individual as scary or life-threatening. Racial trauma is similar in that it is potentially an accumulation of events of racism or discrimination that do impact an individual and can feel life-threatening. But most importantly about traumas, that we know from the research that there are long-term, significant negative impacts on individuals. Bulleted below, what you see there are groups that are particularly at risk of enduring racial traumas. And so that includes folks identifying with the African American community, identifying as Indigenous, Latinx, and Hispanic and Latino, as well as Asian Americans. Just to tie in COVID-19 once again, I just want to suggest here, Asian Americans, since COVID-19 has arrived in the US, have been under drastic risk for violent attacks fueled by racism as folks are responding in fear to COVID-19. Now, we want to move a little bit more into thinking beyond the individual. So, at the individual level, we know that there are serious impacts of racism, discrimination, and prejudice. But what we see consistently across the important systems in our society is that those types of disparities and disproportionalities are evident in all of our systems. And so, in education, for instance, for those folks identifying as Black, Indigenous, or persons of color, which is what BIPOC stands for, you see an overrepresentation in special education programming and an underrepresentation in gifted and talented programs. So lack of opportunity to engage in embellished academic programs. Additionally, we see disproportionate discipline referrals. And in fact, there's a number of statistics that we can rely on to show this a little bit more clearly. And so for white students in school, there's a 1 in 20 chance that they will be suspended, as compared to Black students who have a 1 in 6 chance of being suspended. So the disparity is stark, the disproportionality is stark. In terms of health, my colleague, Dr. Hoover, already mentioned a couple of the disparities we're seeing specific to COVID-19, but in general, we see diminished access to needed medical and dental care. We also see persons of color suggesting that the quality of care is inferior or irrelevant per their needs. We also see increased rates of heart disease, diabetes, and shorter lifespans in folks identifying as BIPOC. Economically, similarly, we see those disparities very clearly. What I really want to pay attention to here is the generational wealth gap. What we know about trauma, for instance, is that there's an intergenerational effect of trauma, in that trauma can be transmitted across generations and do harm across generations. Similarly, with generational wealth, we see the median net worth of a white family is about 171,000, as compared to Black families where the median net worth is about 17,000. And that's particularly problematic when 60% of all wealth in the US comes from inheritance. And so we see these issues related to systemic racism in the economic domain specifically, just transmitting throughout generations, repeating the cycle. And as we see at the bottom there, juvenile justice in the criminal settings, or criminal justice. So we see overrepresentation of people of color, longer prison terms, and the ratios are significant where we compare Black and white again. And I will just note, oftentimes we rely on Black and white comparisons simply because the stark difference is clear, very clear there. And it just gives us that indication that we have a lot of work to do in that area. But what we see is for every one white individual who may be in the prison system, we see 5 African Americans, although African Americans make up a much smaller percentage of the US population. Now, we want to talk a lot about our kids today, and we know that there's a significant impact of the current events on our children. Our kiddos have access to news through their phones, through media, in so many different ways than we had access as young people. And they bear witness to the Black murders, police brutality, and the social justice and uprisings going on around us right now and very actively. And so if we do not talk with them, we leave it to these young brains to interpret the information as they do alone, and which can be very isolating and scary. And so I want to take a moment to pause here. I'm going to invite my colleague, Dr. Cunningham, to share with us a little bit of the dialogue that's going on in the chat box related to this question. So what have been some of the emotions children are expressing related to recent violent events and the increased focus on social justice?
Yes, good afternoon, everyone. Happy to be with you all today. So we've seen some common themes around aggression and anger in children. Also seen a lot of comments related to fear. And there's also general fear, but also fear of the police. And some confusion, lots of confusion with regard to why these things are happening, confusion about, is it me, or is it because people don't like me that they're acting this way? Is there something wrong with me? And just sort of feelings of helplessness and hopelessness, feeling like our society is unjust. So those are some of the common themes throughout the chat.
Thank you so much. And then as we move into this next section, we want to think more about how the content sounds as we're talking with children about race and racism. And we invite you all again, because we know you have expertise and that some of you are parents and caregivers, but also a lot of you are professionals who work with kiddos. Share with us, what are some of the what are ideas or concerns that you have about talking with your children about race and racism? And as like you all begin to chat, we're going to start talking more specifically about some recommendations from the field. A key piece of acknowledgement we have to make is that kids are never too young to talk about race. In fact, we know that as early as 3 months of age, infants are preferring the faces of individuals that are similar to their primary caregivers. We also know that by the age of 4 and 5, we have persons of color, specifically here, African American youth and youth identifying as Latinx, preferring whiteness, given some of the messaging that goes on very commonly in our society around white supremacy. And so it's critical that in these young stages, when kids are already noticing difference and willing to talk about it, that we start to educate them, give them opportunities to express themselves so that they can actually function in the way that we want them to, being accepting of others as well as themselves. A key point here is that silence is not an option. Silence about race reinforces racism because the dominant messaging in our society is around white supremacy. And so in general, when we're thinking about all our kiddos, there are some basic principles that we know are just important in talking with them. And so number one, of course, we all want self-love for our kids. We want them to love who they are on the inside and the outside. Additionally, we want them to be accepting of others, and we want to keep that in mind as we're communicating with them. Further, we know that racism and discrimination exists in our society. It is part of American culture, but they have to be able to anticipate it so that they feel they have the tools and can be equipped with the tools to address it when needed. On that note, we also want to inform our kids that there are coping strategies, and while it may be uncomfortable, they can overcome that discomfort and help to address the issues in our society. And as you see here, we have a resource that you all will have access to, and it's titled Steps to Helping Children Become Thoughtful, Informed, and Brave About Race. And it offers some specific ideas. And so making space for your child's respectful curiosity. As we've already discussed, kids very early on are talking about race. And so it's an opportunity to let them share through play with dolls or books or watching TV and engaging in YouTube videos. Giving them an opportunity to talk about difference and catching them when they say something negative, a negative comment about people of color or any different group. But the key here is being non-judgmental. When you catch it, just simply asking, well, what do you mean by that? And where does that come from? It opens the door and gives you an opportunity to help them understand how they should be accepting of others and how this should be termed differently to be more appropriate. Whenever possible, choosing diversity. And choosing diversity for some may be easier than for others, but that can come again through so many different methods, such as increasing the diversity of books, the characters that are represented, but also ensuring that the characters within the materials or within the videos that kids have access to demonstrate the leadership positions that persons of color can have and demonstrates the beauty of different racial backgrounds and ethnic associations. You also want to learn about and respect others. Learning is fun, and it's so much more fun when you can do it with your child because they are just captivated by new understandings. And so take an opportunity to learn about different cultures, their beliefs, their values, and the ways in which they decide to practice love and engage in unique cultural practices overall. Most importantly, it's important to highlight how similar we all are. There are more differences within groups than there are between. For example, as I started to describe the video of young London that was earlier on our slides, I'm sure folks begin to feel sad that a 4-year-old has to experience that. And so no matter where you come from, what your background is, we all kind of felt that together. And that's a key point for our kids to understand. Finally, we want to just share as much as we can the wealth of information out there about resilience, strength, and resistance and joy that comes from different cultures and different races. It's easy to get caught up talking about disproportionality and disparity as we think about race, but there's so much good that comes sometimes from having to work through difficult situations and adversity. And so whenever possible, try to balance those stories about good and joy and enjoyment of what we know about people from different cultures. And with that, I hand it over to Dr. Cunningham.
Thank you, Dr. Patterson. So I'm not sure if you all have heard of the term racial socialization, but it is the process by which children are socialized about race. And so thinking about what meanings or significance of race and how that is communicated to them through their family, through friends, through society. And so it's really important to think about, Dr. Patterson mentioned earlier about how critical it is to have these continued ongoing conversations with your children. And certainly with Black children, and thinking about ways that you are going to have those conversations and how to facilitate those. So we'll talk a little bit about that process and kind of break down racial socialization a little bit more. One of the key things, and I think key points to communicate to children certainly is that, although they are different, that their difference is a gift. It's not anything to be viewed negatively. It doesn't mean that they're less than, particularly when thinking about Black children, explaining that, the reason their skin is different is more brown or less brown is because they have more melanin in their skin, and just, it doesn't mean that they're dirty. Sometimes kids will make up things because they don't know the answers. And so being very concrete and explaining those things in ways that kids understand can be helpful. Explaining that racism and inequalities exist. I think, we don't want to scare kids, but we do want to make sure they're aware of some of the differences that exist in society. We don't want to overemphasize the inequalities and how much things are different, but if we're preparing young children of color to go out into the world, we don't want them to be shocked if someone says something, unfortunately, that is, racist, or they experience discrimination. You want to prepare them that, unfortunately, there are still some people in the world that may not be so nice. And so, helping to prepare them to deal with those situations is really important. Another component of racial socialization is focusing on equality. As Dr. Patterson mentioned, viewing that video, most of us felt sad or some, negative emotion from viewing that video. And so explaining that, although we may look different on the outside, on the inside, there are a lot of similarities amongst all of us in society. So that is an important message to communicate as well. Also affirming their self-worth, repeating how important they are, how beautiful they are, how smart they are, how much you love them. Those things, those messages are really critical for children to hear as well. I think one of the things that we have seen in terms of racial socialization, I know sometimes parents or adults in the household with kids are a little afraid to have, the talk with them about racial issues or things going on in society. But what we have seen in terms of some of the research is that when parents or adults in the household either focus those conversations on entirely negative events in terms of why, all the negative outcomes associated with being Black or a person of color, or don't have that conversation at all, that's associated with less positive outcomes. So we do want to make sure there is some communication about these issues. That's really critical. And you can tell kids, you feel awful that you have to share this with them, that our society is not in a place where, everyone is treated equally. So, we're excited and energized about a lot of the efforts that are taking place now. So maybe, 20, 30 years from now, parents don't have to have those same conversations with their kids. But in terms of what's happening currently, definitely it's important to inform kids about that. And when you're talking and kind of helping prepare your kids for what might come their way, one thing that can be helpful is talking with them about how they may respond in different situations. So if they experience discrimination or see a friend of theirs being treated unfairly or differently, how might they respond to that? How would they feel about that? Getting them to kind of start thinking about their response can be very helpful. So if it happens in the moment, they already have a plan for how they may respond. And you can go to the next. Yes, thank you. And it's important as well to think about instilling racial and ethnic pride into your children as well. That's a critical component of racial socialization, and really talking, a lot of times kids will hear a lot of, certainly when stories about slavery and all of the negative things that happen to Indigenous folks and people of color. in the past, but they aren't often taught about the resistance and how resilient their ancestors were and how they fought back against oppression. So it can be helpful to share those stories as well about how they survived and thrived through some really difficult times. So similarly, although things are difficult now, reinforcing that you all have a resilient family and you all will be able to get through this. I think it's also, really critical to read and share books and stories about movies and books, as Dr. Patterson mentioned as well, that have Black protagonists. When we think about the huge success of a movie like Black Panther, part of that was because kids had never seen so many people who looked like them, that were intelligent and smart and strong and powerful. And so that movie meant so much to so many Black children because of that position that they're able to see themselves on the screen. So that's an important message to share. And just really providing constant affirmations about culture and cultural awareness is so critical and so important. And having continued discussions. So, if you don't want your first conversation about racial differences and discrimination to be about police brutality or something negative, a negative incident that happened, really want to start those conversations early, because as we know, kids are very well aware of those differences. And so thinking about how you can incorporate those discussions throughout your interactions with your children can be helpful. Okay, and so there is a phrase called anti-racist. So not sure if you all have heard of that either, but some theorists have stated that it's not enough to just say, I'm not racist, because that implies a neutrality, that you're not really taking action towards change or making a change. And so anti-racism really refers to taking some proactive action to really break down and dismantle the systems of racism and oppression that exist. And so how do you do that? And this is for anyone, not just Black children of color, but everyone can kind of take an active effort in raising anti-racist children. And so, as we've mentioned, it's really important to discuss these differences at an early age, not keep the blinders on, and certainly acknowledge that these things are happening in our society in terms of bias and discrimination and white privilege. And one way to discuss that with kids is through their everyday experiences. For white children, maybe explaining to them, if you're walking down the street late at night in your neighborhood, maybe asking, how would this experience be different if we were a Black family walking down the street or in this neighborhood? When you're looking at a TV show, pointing out the lack of diversity in shows. So there's lots of everyday experiences where you can bring up these different topics and talk with your children about them. As I said earlier, really thinking about how children may respond if they see, experience, or witness discrimination or bias, and how they might speak out about that or take some action. And I think it's also really important for kids to know that this is something that is really critical in terms of how you want to sort of live your lives moving forward, that this is not just part of the moment, that you're going to make a defined effort to really have a mission to really engage in anti-racist actions and behaviors. And even long after the cameras are gone and the hashtags are over, that you will still be committed to the work. And this graphic, I think, gives a nice overview of kind of the different areas that someone might be in related to becoming anti-racist. So there was a similar graphic that was out related to COVID that may seem a little familiar if any of you saw that, but this one was developed by a physician about the process of becoming anti-racist. And I think it just kind of helps to highlight different zones, and you can kind of take a look at it to see where you think you might fall on that spectrum, and recognize that sometimes we may, go to the right, come back to the left, sort of depending on what's going on. It's not a static incident, but just, recognizing that we're continually learning and growing and evolving in this process. And Dr. Kara Banks is a psychologist who came up with this acronym, Raising Equity Nerds, that I just love. Because when we discuss equity with children, there's not a lot of focus on discussing equity. When we think about a lot of our efforts and attention with children, we put a lot of energy on sports, on, academics and, test prep. And, what if we put that same effort and energy into raising children who were had a mindset focused on equity and really having attention to this equity issue wherever they went. And so she came up with this acronym for equity nerds, which I think can be helpful when you think about how to do this work. So one, the N is just name it, name the system of oppression that's existing, talking about structural racism or institutional racism and how that is a factor. Educating yourself. We've talked so much before about how important it is to learn and dive into some of those history books and learn with your kids about things that are going on. So education is a critical component. Reframing is important. So if something, incident happens, reframing that it's not just an individual incident. Certainly it may have happened to one person, but it happened in the context of a larger system in a larger pattern of, again, that systemic oppression. And so just helping to reframe the larger issue. And the D is for dreaming up solutions. So if this is, based on what happened, police brutality, a negative incident, what's your solution? How would you solve this issue? Getting kids to think about solutions can be very helpful and also gives them a sense of some control around the process. And then S is what is the smallest possible step you could take as you move forward with that solution that you just sort of dreamed about. What's one small step you could take in terms of taking some action towards that solution? So that is a way to raise equity nerds via Dr. Banks.
Great, thank you so much, Dr. Cunningham. So we've had lots of comments coming into the chat box in response to this question about what ideas or concerns do you have about talking with your children about race and racism. And I'll just touch on a few of the themes that we saw. So a number of people mentioned that they worry about the joy and innocence being taken away by bringing up the topic too early. We heard some comment that it brings up past emotions for adults that are hard to contend with. We had a number of people say they're worried about saying the wrong thing or they have a hard time finding the right words. And we had several people say, do you have talking points or guidance? And we are going to move in a moment to the resources section, in which, yes, in fact, we do have a number of pieces or a number of resources rather that can help with that area. And we had a few folks mention, I want my child to have a positive image of themselves, and I worry that this conversation will interfere with that. So hopefully some of the resources that we provide, coupled with your own intuition and expertise of your children and your family and your community, will help with some of that. So we're going to move to coping, and we're going to talk specifically about some strategies and resources. We've seen some come into the Q&A box, and we've been trying to share those out with the audience. So thank you for sharing resources with us. We want to first ask you, what are you doing to help children cope? And that may be in the form of actions you're taking or specific resources. So please enter those into the chat box, or rather into the Q&A box. And we're going to take a moment to share some general resources with you and strategies for supporting all children. And then we're going to have a specific section focused on supporting Black children and families. So first, in terms of some things we can do to support all children right now, first, validate feelings. We know that it's important to check in with your child. Kids, even very young ones, are extremely perceptive. They may have worries or concerns that they don't even know how to express. And it's important to meet your child where they are, acknowledge their feelings or their fears or their worries. Second, and Dr. Patterson already said this, don't avoid talking about it. This is a conversation that I would say for most Black families has never been optional. White parents can help also by addressing race and racism with kids early and often. Be clear, direct, and factual. Even with very young children, use clear language. So, for example, instead of saying, people are upset because some groups treat other groups unfairly, instead say, this is about the way white people treat Black people unfairly, or this is about how Black people are treated unfairly in our society. Encourage questions, and don't worry too much if you can't answer them. These aren't easy subjects. Feeling uncomfortable in a conversation is normal, but it's not a reason to stop talking. Try to be calm, but also don't hide your emotions. It can be helpful to pick a time where you are feeling centered and maybe have had a chance to work through some of your own feelings, but at the same time, it's really important that we don't hide our emotions from our children, that we let them know when we're sad or we're angry, and that we acknowledge that it's good to be upset when we see social injustice. Rely on your support system. So we know, and we've talked today about how witnessing scenes of racist violence is deeply upsetting for many parents, but for parents of children of color, it can also be very traumatic. So take the time to check in with your own mental health. If you're feeling exhausted or overwhelmed, reach out to your own networks for support, because it can help you in turn support your children. Keep the conversation open. Like any important topic, racism and violence are not something that you can just have the talk about once and then move on. This is an ongoing conversation. And finally, explore resources, and we'll share a number of those with you in a moment. In terms of coping, another thing that we want to emphasize can be a very useful coping mechanism for adults and children alike is activism. And so we encourage you to support young people's activism, and there's a number of ways you can do that. I'm not going to go into great detail here. We'll go ahead and put a link in the chat box for 7 ways that you can support young people's activism during this time. I'll go ahead and pass it on to Dr. Cunningham, who's going to speak specifically to resources to support Black children and families.
Hello again. So there are some resources listed here specifically to help Black families deal with racial trauma. So there are some toolkits. There's also a link to something called emotional emancipation circles, and which has been shown to be very helpful for Black families to have an opportunity to discuss generational cycles of trauma and how you will move forward. There's also the BEAM, Black Emotional Mental Health Collective, has some good webinars and trainings on their website as well. And in general, we have several other resources listed here just regarding racism, anti-racism. There are some tips for talking to your children. There are also tips here related to educators or folks who work in schools, specific to dialogue guides and tools that you may want to use in your classrooms. And some more resources. Some of you, I saw several comments in the chat about books. Several of these links here will also take you to several books about race, racism, equity, and they're organized, many of them by grade and age range. So feel free to take a look at those as well.
All right. Well, thank you all for continuing to engage with us via the chat, the question and answer function. You all have a number of great coping strategies, and I just want to read off a few of the themes. So a number of folks are relying on use of age-appropriate books for talking with kids about race and racism and coping. Also, folks are attending other online events and educating themselves. And so there are a number of folks that indicated they don't currently have children or are not caring for children right now, but in the meantime, they're educating themselves, which is a responsibility for every single one of us. And then others, a really human level comment that I saw continue to pop up was folks are just trying to be vulnerable and acknowledging that we are not going to get it right all of the time. And that's what this isn't about. It's not about getting it perfect. It's not about saying it the right way. It's about being open to having the conversation and taking the risk and being vulnerable to making mistakes so that we can all grow. And so with that, I think we want to move into some questions, and just thank you all again for being engaged with us. And we look forward to hearing some of the questions.
Well, let me thank the 3 of you on behalf of, I'm sure, everyone on this call, on this webinar session today for all that you've provided. It's been so insightful and just a real font of information, and we're really grateful to you. There were a lot of questions about tools and toolkits and talking points, so I'm glad that you were able to share all of those resources at the time. Let me say right at the top before, and I posted this in the chat box, I'm not sure if everyone saw it, but many people asked if this information would be shareable because it was so valuable and people wanted the slides. This session, as well as Tuesday's session, are available to anyone to go back to at any point at www.ums.org/notallwounds. And it is in the chat box. I'll say it again right at the end, so you can look at any of that. Tuesday's session is already posted for you, and this one will be up in about 48 hours. The Q&A box has been very active and quite robust. There are a number of questions, so if we're ready, let's see if we can get through some of these today. Here's one. My child is biracial. How and when do I begin to discuss race with her? And are there good resources for this particular conversation? Anyone?
Yeah, I think I can start off. I would just say in general, for any kiddo, especially kids of color, who are going to be pinned as different pretty quickly, mixed race kiddos being included in that group as early as possible. And it starts, it doesn't have to be an explicit conversation about white supremacy early on. It could be more about just loving oneself and exploring what it means to be biracial and exploring the pride that a family may have on both sides of the family and models of who the parents want their child to potentially become, or just see parts of their character within these models in their community. And so as early as possible, in terms of resources, a number of the resources shared I think lead to books. Some have general talking points, but to go back to some of the slides we shared earlier, there are just some specific core principles to keep in mind when talking with children. So my main point, early as possible, and perhaps rely on some of those general principles.
Great, thank you. Another question is, can someone talk about racism against Asian Americans? Who would like to take that one?
I know Dr. Patterson mentioned earlier that there's been a lot of racist comments and related discrimination and all sorts of other things related to Asians related to COVID. And so that has certainly been a challenge, I know. And I'm not sure about the question, if they're wanting to know about the impact or how to talk with kids about racism. But certainly, we're all impacted. Racism is not specific to one race or one culture. There are people who hold a host of ideas about good and bad about different races and cultures. So I'm not familiar with the research, but I'm sure that some of the same impacts in terms of the impact of racism, in terms of, mental health issues related to depression, anxiety, higher stress, I'm sure many of those things would also be prevalent in the Asian community as well.
Yeah, I'll go ahead and.
So I read the question. Sharon, let me just say this. So I read the question as it was phrased, but I would imagine there's two parts to that, and much of what's been discussed today is also applicable to the Asian American population. But I also would think that given the COVID-19 issue and some of the incidents that we saw against the Asian American community is part of why the question was posed.
I agree, Donna. I mean, we don't know the intention of the question asker, but much as we're talking about racism in the Black and African American community in terms of the context of now and the context of always in the long history, Asian American racism, we know that there are particular facets that are concerning now in the context of COVID, but there is an extremely long history of racism against Asian Americans in the US in particular, and certainly in some of our neighboring countries as well. There was a very good news hour on PBS recently that spoke to the long history of racism against Asian Americans. I'll go ahead and put a link to that in the chat box. But as both of my colleagues mentioned many of the resources we spoke about today in terms of how to talk to children about race, when to talk with them, and how to support coping, I think would be applicable. And also in terms of supporting cultural identity.
Let me say this to our audience. As we post this webinar moving forward, I also think we'll try to pull out many of the resources that so many of you shared in the Q&A box, because they're really very, very good, and they're additive to what's been shared by our panelists today. Here's another question. This one is a little different. Why don't my Black friends want to educate me about racism?
Oh, I'm sorry, I didn't realize I was muted. I think that for many people in the Black community, they feel, and I'm certainly not speaking for everyone, but from what I've heard and experienced and been told, they feel that that's not their responsibility to educate other people about the history of racism, discrimination in our society, that there are lots of resources and information out there for people to do some of that work on their own initially. And I know other Black people who are wanting to share information and have conversations about their experiences. And so, but I also know for many Black people that also triggers, certainly other feelings, may not necessarily, may have not feel comfortable. There may be concerns about trusting, kind of what happens with that information after it gets shared. Oftentimes many Black people have been put in a position to have to explain repeatedly, about various situations time and time again, and many are just kind of exhausted at this point in terms of providing those explanations and information.
Yes, and I will just, sorry, I was just going to add to that comment for just a question. I just want to appreciate asking that question. Because while you're observing a reaction, perhaps when you want folks to provide some more information, ask the question, receive the response, and then use perhaps some of the resources that have been shared to do a little bit of deeper digging, there it is, to learn a bit about the experiences of your Black colleagues and friends, before asking more questions, because there is so much out there. But I just wanted to appreciate the risk you took in asking that question of us, and encourage folks to just be vulnerable and take those risks and ask the questions.
Very
just
good.
One thing to add quickly, Donna, is just that certainly from some of my African American friends and colleagues, they have not only, I think, kind of a general frustration sometimes with their white friends and colleagues asking the question, but even more so now, an exhaustion with what's happening and a frustration that it seems that some people just woke up to the things that are happening. And so the question feels almost offensive at times. And so there is that balance of doing your own work and not expecting others to do the work for you.
Thank you, all three, for those answers. This question relates to one of the earlier slides where there was a note on it. And the question is, what is meant by your difference is a gift?
I think that was what I mentioned when I was presenting on cultural identity and racial socialization. So oftentimes, race is kind of presented to young children as Black or white. That one is, they pick up a lot of messages in the media that, white is better, white is more superior, the white dolls have the long, pretty blonde hair, and, you're different. So, making sure young Black children get the message that although their skin is different, that they are still beautiful, they're still special, they are unique in that way. And so not associating differences with negativity.
Is there a cumulative effect of being a racist on racist white people or their children? Certainly racism must be a mental health issue. Question.
There's actually been some interesting research on the impact of racism on white people in general, and then more specifically, as this question asked about, on white people who actively discriminate and hold prejudice against people of color. Not surprisingly, the literature's general findings are that racism is bad for everyone, that we see, for example, that for white people, the experience of racism or being actively discriminating and racist against other groups causes moral ambiguity, causes them to not have associations with people who are different from them. And so a number of factors that ultimately have negative consequences for white people. So there is an interesting body of research on it. And I should just note that within the research, the researchers themselves certainly speak to the idea that the consequences are by no means comparable to the consequences experienced of systemic racism on people of color, but it is an interesting body of research.
And one last question for today, which I just lost. So the question, paraphrased, is how do we deal with the fact that continuing to post and show racial injustices, does that lead to further stereotyping of a community? See if I can get that back. So in other words, we see so many negative images in the media now. Is that worsening the problem, or is that helping us? Here it is. How does one manage or appropriately respond to the question or concern that highlighting racial injustice perpetuates stereotyping without it becoming a negative interaction or disrespectful dialogue?
I guess I'll just say, and I invite my colleagues to also make comment, that we do see it's easy when we begin to think about race to talk about and focus on disparity and challenge and potentially see a lot of stereotype and stereotypical information in the media. And that was one of the key recommendations I think we hit on a couple of times today. It's important to balance stories that also show the actual diversity of a group of people, including the stories of resilience. And so we do need accurate information that highlights the disparities that continue to exist. We need it, or else we will not work on it. At the same time, we need to tell the whole story. We also need to see what goes on every day in the lives of diverse individuals that is worth celebrating and is exciting, and it's not filled with hardship every step of the way. And so we need that balance of information as well.
All right, so I lied in part. One last question. We'll just squeeze this one in here. How should African Americans bring up awareness of racism in the workplace when it's occurring in the workplace?
When it's occurring in the workplace, how they should bring it up. I think, that depends on the person. Some people take a more active approach to dealing with those situations. I think if we are wanting to dismantle, these racism, help people become more aware of their biases that they may have and may express, I think it's important to bring it to their attention in a, certainly in a professional way. So perhaps asking, well, what did you mean by that? Or, this is what I heard. This is how I felt when you made that statement. But also I think it can be very beneficial to not have that be an independent conversation. So, talk with your supervisors or colleagues about, how can we take an active role in creating an environment that's supportive for all people. I talked before about, anti-racism and how are we going to take on a role within our work environment to make sure that our environment is comfortable for everyone, and what action steps are we going to take to make sure some of those things get put in place.
Although we're at the top of the hour and we need to bring this to a close, I have to say, both for today's session and the session on Tuesday, I felt we could go on for another hour and still, address so many of the issues that have been raised and address the concerns that people have. Clearly, it's a topic that people want to talk about and want to engage with. Hopefully, you've received a number of tools. You go back and look at these sessions again, and you can begin to have some of these conversations. Just for everyone's knowledge, again, on just the COVID-19 issue, there's a nurse call line available. It's on the site right now, 24/7 at 888-713-0711 if you want to talk about symptoms that you may be experiencing or other information. And there's our website at ums.org/coronavirus that you can go to. And then importantly, related to the session today, you can see this webinar within the next 48 hours or Tuesdays at ums.org/notallwounds. I want to thank everyone for joining us today. This has been a very robust conversation. It's an important time. We have to seize the moment. Perhaps there's never been a time like this where there's so much focus and people are beginning to understand issues that have been occurring in our society for a very long time. And so we hope that you now have the tools not only to help yourself emotionally and mentally with regard to this issue, help your children and your families, but also an awareness of our collective responsibilities to address this issue moving forward so that we can advocate for change. And I thank you all for joining us today. Have a great day.